So, two states where coronavirus cases are jumping are taking sort of very different approaches when it comes to reopening alongside spikes of infections. In California, Democratic Governor Gavin Newsom has ordered bars in several counties to close and hinted that he will tighten restrictions even more later today. Meanwhile, Florida's Republican Governor Ron DeSantis stresses that there is no need to shut down shops and restaurants, saying the state can deal with the uptick in cases. So, Dr. Neeta Ogden has been following all of this stuff for us and with us, and she's joining us now. Okay, so there's two different strategies at play here. And it's not just, we gave two examples, but some governors kind of feel like once you've started the reopening process, we just can't reverse it. We can't go back to what it was before. And so now we just have to manage the cases moving forward. And then other governors are saying, no, we will stop and we will go back. You will see new restrictions. How do you see, what's your take on these two strategies, I guess?
Well, I think that this is part of the problem with how lawmakers are handling coronavirus. They are seeing it as a political issue and tying it to, for example, how they're perceived, how they may fare in a future election. And the reality is that coronavirus is, we know that it supersedes those boundaries and that it's a very dynamic situation. I liked what Governor Newsom said yesterday, that what he's doing is sort of a toggle. They can go back and forth with what he's decided. It's like I said, it's dynamic, whereas I felt the governor of Florida, he feels like he has to stick to a message when certainly that's not how the virus works. Right now, he believes that their hospitals are not overtaxed, their ICU beds aren't at capacity, that they have room if things get worse. But we know that that can change very quickly. And I think the greater message here should be that we have to watch what's happening at the population at large before we can make these blanket statements about not, going back and restrictions. In fact, that's what will control the virus and lead to greater freedom for people later on.
Dr. Ogden, during the Senate hearing yesterday, 4 of the U.S.'s top health experts pleaded with Americans, especially younger ones, to wear masks to curb the spread of the virus. We're starting to see Republicans and staunch supporters of the President of the United States coming around to this idea of urging their constituents to wear masks. This is anecdotal, but I have family and friends in Taiwan and in Hong Kong, and they are astounded that we are still struggling with whether or not to even wear those masks. I have one friend who told me that when we hear of somebody or anybody getting infected in Hong Kong, for example, everybody, the entire island gets very, very fearful, and everybody doubles down on the things that you're supposed to do to protect one another. As you and I and Anne-Marie have talked about on this air, face coverings are meant to protect other people in case the wearer is unknowingly infected but does not have symptoms. Can you just reiterate to our viewers why it is so important to wear the mask regardless of your political affiliation or where you live?
Yes, I totally agree, Vlad. And I think that I wish, I think we're increasingly getting that there was a national mask mandate, that there's no question that people should be wearing masks. There's increasing evidence that if you're not the one who's sick, you could be protected. The University of Iowa just came out with a study that if 95% of Americans wear a mask, we can prevent 30,000 deaths by October 1st. The use of masks between April and May of this past year led to a decrease in 200 to 400,000 COVID cases. So this is not something to even question anymore. And unfortunately, it turned into something else in this country about freedom and individualistic rights. We had mixed messages coming from our leaders, especially President Trump. And thankfully, there's a greater message out there now that this is not something you can question. If you want to go back to school and you want to have a normal life and open up businesses, masks are such a huge part of that. Unquestionable. This is not something people should even think about not doing. And we need to get to that place where everybody's on the same page. In fact, Goldman Sachs came out with analytics that if we did have a national mask mandate, it would actually save Americans a huge dent from the coronavirus economically. So the message is there that we need to continue to wear masks. It's a simple step that we can all take. Don't go into crowds, but if you have to be in a crowded space, always wear a mask. When you're outside, always wear a mask. It's just the bottom line when it comes to avoiding transmission of the virus.
Yeah, and increasingly we're hearing, doctor, that wearing a mask also protects you from contracting the virus. So if you really don't care about other people contracting it, how about this? So why don't you protect yourself? One of the things that I find so concerning about this virus is I really feel like weekly we're learning new things, and some of the stuff is just anecdotal, but we're hearing all sorts of stories about side effects lingering much longer than just a couple of weeks. And now we've got a medical examiner out of Florida that says that what this medical examiner is seeing is that even people who are asymptomatic are showing lung damage regardless. Can you talk a little bit about that?
Yeah, so this is an interesting study, actually, that came out of Scripps, which looked at asymptomatic individuals from the Diamond Princess cruise ship. And those people in the study had CT scans. So they're asymptomatic. They had CAT scans of their lungs. Those CAT scans showed that they had changes in their lungs, those ground glass changes that we heard a lot about that is typical of coronavirus. And they had no symptoms. They did have these subclinical changes on their lungs. A lot of medical examiners post-mortem have reported lung pathology that's kind of astounding in coronavirus patients, any microclots, things that we haven't seen before in typical infections. So what's clear is that there needs to be more research done on how, for asymptomatic individuals, coronavirus may affect their lungs. Now, it's hard to always say if someone's strictly asymptomatic. They may have had slight symptoms and had these lung changes as well. The more important thing also is to know, is there any long-lasting effects from these changes in the lungs? We do know coronavirus has a very prolonged effects in some people, and they complain of recovering but still having headaches, coughing, difficulty catching their breath, just not getting to the place that they were before they were sick. So I think that this study kind of points to the anomalous nature of coronavirus, and that it may have unusual effects in people who may not even have symptoms.
Really important information as always. Dr. Neeta Ogden, thank you very much.
Thank you for having me.